Good morning. I'm Dr. Amit, Director Founder of Divine Cosmetic Surgery, Plastic Surgery Center in Delhi and in Gurgaon. I'm going to talk about how badly the medical tourism industry has been hit, how international business for plastic surgery has been badly hit by this coronavirus pandemic. And the interesting thing is that I actually got down to see some of the projections and the numbers of the medical tourism market in the country. And I came across some amazing articles. Now, in this article, which is published on CNN, it says that the in 2015, India was the third most popular destination for medical tourism, and the industry was almost $3 billion worth. The number of visitors was 234,000 that year. Now, these are the official visitors. In India, a lot of people come for tourist purposes. We must also know that till a couple of years back, in fact, I think till last year, patients had to apply for a health visa, a medical visa, and that was actually quite difficult. Patients used to tell us that the Indian missions abroad would make it very difficult for them to get health visas. Now, in spite of that, 234,000 visitors in the year 2015 on the health medical visa, and there are at least 4 or 5 times the number of such people who have come on a non-medical visa. So they would come for small procedures, daycare procedures without admission. Mark that for overnight admission at this time, it was mandatory for the hospital or the doctor to register their patient with the FRRO, and that became quite complicated. So patients who did not come on medical visas would need to then get registered with the FRRO office. So made things are very complicated. So I would assume that at least 4 or 5 times this number was actually already in India on tourist visas and would be getting surgeries done quietly or other procedures which did not really require something like, say, Botox or something. Now, the article also goes ahead and says that by 2017, the arrivals doubled to 4,94,000, 95,000. It's nearly, and it's more than double. And gradually, the government, realizing the potential, stopped some of the bureaucratic red tapes. They stopped. Currently, we don't need a medical permit, medical visa to come for surgeries, and patients can come in and do the surgeries like any Indian would. So the visa rules, of course, have been relaxed. With the e-visas, it has become a lot more easy. Now, it was being thought that by 2020, this industry would reach $9 billion. I mean, it's huge. And this is the official. The unofficial one is probably double of this. So this is the amount of business that was expected to come in 2020. Now, following this pandemic, any form of medical tourism, for that matter, international tourism or domestic medical tourism, has totally crashed. Domestic tourism means that people from outside states, so from, say, Delhi, from Bombay coming to Delhi, from Pune coming to Delhi, so that also crashed. So that was a form of domestic medical tourism that has totally crashed, and the size of the domestic medical tourism has been at least 2 to 3 times of the international tourism. In fact, in the initial months, even from the adjoining cities, people could not come for their surgeries to Delhi. So, what meant was that that 9 billion industry just crashed, just washed out. And it's only, and we don't foresee, being in the plastic surgery sector, we are not forcing any revival of business in at least till December, because it's the fear of patients to take flights, come across, and then the quarantine laws, etc. So I presume that we will not have international tourists coming in for plastic surgery at least, and for a lot of other specialties till at least February or March of 2021. And that has been the huge amount of loss the medical industry has had to face. India, of course, remains a favorite destination for medical tourism. The reason being the high quality of work as well as the lower cost. So, for example, a breast implant surgery costs about 2,500 US dollars here, where any similar center in US would charge not less than 7,000 to 8,000 US dollars. So that is the amount of savings in terms of knee surgeries is even more. Now, while NHS in England could not cater to a lot of these procedures, patients would then not go to the private practitioners in UK. The wait at NHS would be so long, they would happily fly down to countries like India. Now, It's not without problems as well. So when you're talking of medical tourism, it's not without problems. One of the problems has been the management of complications. So there is no legal recourse to any of these things, because once you're abroad, then how do you tackle so if something goes wrong, then it becomes a real challenge for patients. And I'm sure these are some of the things that patients have taken into consideration when